For everybody watching or listening, Dr. Sulak is a physician, a doctor of osteopathy, an integrative medical practitioner, an educator, I would say an entrepreneur, and a cannabis clinician. And I think more importantly, in my opinion, you're almost a bridge between the scientific or the academic literature and and I guess cannabis is a more holistic or therapeutic medicine or herb. Did I get that right? Did I miss anything in
Thank
there?
you. Yeah, thank you so much for affirming that and acknowledging that. I've thought that that's a big part of my role and gift in this field. So thank you.
My pleasure. So you've been using cannabis, I guess, for almost a decade now. You must have been one of the first practitioners in your area to be doing this. Can you talk us through how it all began?
Sure. Yeah, it's actually been almost 12 years now. So first of all, my background was in the healing arts even before I went to medical school. I've always been interested in healing and how to stimulate healing. And to be totally honest, a lot of my insights around this incredible process came to me, and I kind of consolidated and understood them in a new way with the help of cannabis assisting my consciousness to look at things in more of like a global perspective, more of a systems based concept of physiology and of health and healing. And then as I learned more about cannabis, I realized, well, it's this incredible healing herb and it has so much to offer. And then that drew me into this understanding of the endocannabinoid system and this physiologic system that really keeps us healthy and helps us respond to illness and injury. Despite all of that and a long history of working as a cannabis activist to try to legalize cannabis basically wherever I went, I still really didn't expect that cannabis would be the main focus of my medical career. I thought it would be the healing arts, and that I'd be able to use cannabis. But there was no, there was just no landscape for that because I had never done any training or practiced in a place where cannabis was legal. So I came to Maine, which is in the Northeast of the United States, and I opened a private practice. I planned to do osteopathic treatments, hypnotherapy, integrative medicine. I was really in the right place at the right time when our state significantly expanded a previously very limited cannabis program. So suddenly there were thousands of patients in the state of Maine who were using cannabis illegally, and all they needed was a doctor's signature to do so legally. And I was pretty much the only doctor in the state willing to do that for several years. So thousands of cannabis patients came my way. I learned so much from them, and I saw, a vast range of health conditions, use patterns, types of cannabis. I mean, it was just all over the map and really an incredible crash course. So that's how I got started. I'm so thankful. Now almost 12 years later, I couldn't imagine practicing as a general practitioner without this tool. I'd very obviously be using other tools that are more dangerous and less effective.
It's a beautiful experience that it was almost the patients giving you the feedback as well, because it is a very individual process with cannabis medicine, right? So to learn that way is amazing.
Absolutely. I'm so glad it went that way instead of like some intellectual approach where I took a cannabis course and then dove in with patients. It was fun to be at the front lines and just kind of hanging on for the wild ride. And while I was hanging on, like you brought up before, turning to the scientific literature and realizing there was quite a bit there to guide me and to kind of support these wild observations that I was having and tell me, no, I'm not crazy. This really could work. So thank you to all the researchers and the subjects and the animals that, had, been creating this huge body of evidence that really never landed for most clinicians, that they were just very disconnected from that.
So we've been using the Healer platform, another one of your, I guess, educational pursuits for about a year. It's such a fantastic platform. And for anybody listening now, I would encourage you just to, in Australia specifically, if you're interested in becoming involved in cannabis or learning more, it's even worth just signing up for the free webinars that come along with the Healer platform. Can you tell us a little bit about the platform and what the goal is there and the vision?
Sure. Well, this started because one state where we had some businesses that we were supporting and working with, Maryland, became the first state that required anyone working in a dispensary to have a certain level of training and education. And so one of our dispensary friends said, hey, Dr. Sulak, can you give us a training program that fulfills all these requirements set forth by the state? And when I looked at those requirements, I just got inspired and I thought, wow, we can do a lot more than that. Let's really train these dispensary agents to be excellent, bridges, so to speak, to use the word you used before, because, what's been happening here in the States is that lots of doctors will sign off on the cannabis certification, but provide the patient with no instructions at all on what to do with cannabis. And there's just so many options. So they go to the dispensary, and this poor person, who's working the cash register essentially is thrown into the role of a clinician. It's just not fair to them and not fair to the patient. And I've spoken with enough dispensary agents to know they need some support, and they're the ones doing the work. Like, they're not just selling products, they're making therapeutic connections, they're following up with patients, they're giving emotional support and love, and they're having to choose products and dosages. So I saw that as a wonderful opportunity to dive deep and really translate the things that I had been teaching clinicians to this non-clinical audience and make it very accessible. And in doing that, I realized, well, there's a lot of patients that want to learn this. There's a lot of caregivers that want to learn this. And there's a lot of clinicians that actually like this program too. So it was a big surprise to me how it really took off way beyond just industry professionals. And that's, so that's how it all started. So we have a core curriculum. We have a curriculum that's all about dosing, that touches on individualized dosing plans and specific conditions. And then we have a whole nother curriculum that's about CBD and hemp-based products. And as you mentioned, these monthly webinars, and what we do with the webinars, so helpful for me and our audience, is to stay up to date on the literature. So every month I take a handful of studies that have come out in the previous month or two, and I, simplify them down and report their findings. And these are all studies that I feel are clinically relevant, or at least exciting new information in the field of cannabis. So yes, those webinars are free when they're live. And then if people want the deeper dive and pay to sign up for the course, they get all the previous webinars with timestamps, so they can jump straight to a topic that interests them. But I love it. We get a great big audience for the live webinars, and I invite all your viewers and listeners to dip their toe in that way.
Yeah, amazing. We'll have links in the description and on the page somewhere for people to access that. So you've already touched on this briefly, but you're obviously motivated or deeply motivated and interested in helping your patients heal through different modalities, I guess, different to the current paradigm. Like, I've heard you speak about mindfulness, you practice osteopathy, breath. How does cannabis fit into this picture?
A great question. So I think that from what I've seen, cannabis can be used kind of like a simple drug. It works very well for relieving symptoms and, helping people sleep better and stuff like that. And people appreciate that. But, when we think about someone who's had a healing experience, it's not often, oh, my symptoms got better and I'm all healed now. No, healing is more of a shift in the patterns of our physiology and our thinking and our behaviors. And those shifts are more likely to occur when someone's, number one, in a state of wholeness, because their entire being can shift as one. And that becomes a much more profound kind of global shift. So how to enter that state of wholeness is a really big question. And can we use cannabis to augment some other strategies for entering that state of wholeness? And then also, how can we, and it's part of entering the wholeness, how can we disengage from the limiting patterns that are currently there, keeping us in our old ways that have failed to adapt or adjust to our ever-changing life and ever-changing environment? And so what I've seen is that beyond symptom relief, cannabis is this incredible adjunct to a wide range of non-pharmacologic therapies. One great example is yoga. I've had so many patients that love yoga and that find that cannabis helps them, but have never tried combining the two. And when I suggest that and they do that, they're just amazed by how deep they can go into the hatha yoga, how deep they can go into the meditation, and really enter that state of oneness where healing is much more possible. I think that cannabis facilitates that disengagement from these old dysfunctional and compensatory patterns, but it doesn't create, or when it's used correctly, it doesn't have to create so much dissociation that by getting away from those old patterns, we're just getting away from everything. Actually, cannabis can be really powerful for integrating body and mind and spirit together. So it's this beautiful combination of disengagement without too much dissociation, followed by integration. And so for the viewers that haven't tried combining cannabis with either exercise, meditation, prayer, singing is a great one, yoga, there's so many things. What I have on my website, healer.com, totally complimentary, is a whole section of wellness practices, just really simple breathing practices, movements, and meditations that I think are great to use anytime, but especially in combination with the consciousness altering aspects of cannabis.
Yeah, it wasn't until, and we'll dive into this later, it wasn't until I heard you reference the term anhedonia. I hope I got that right. And I started reading more into this and using very small amounts of THC with a meditation practice to generally, I guess, because of the stigma, and especially still in Australia, you kind of feel like you're doing a bad thing if you're using THC with a mindfulness practice. But it's not until you realize that it can be used as a tool to enhance that experience that it goes beyond that. But I want to talk about that term in a little bit. I was wondering, you must work with patients who aren't open to different kinds of healing or alternative medicines, so to speak. Do you ever find that you get the opportunity with cannabis to use it as a gateway where people can approach their health in a more holistic way?
100%. It's amazing. Like, it was kind of like this when I started, where it was all these people already using cannabis, but had never really dipped their toe in integrative medicine or alternative medicine. And they'd come see me for cannabis, and then I'd say, let's get on the table and do a treatment. And they were like, what was that? What just happened? I feel so amazing. Yeah, that's an osteopathic treatment. We're freeing up, limitations in your structure and the function of your body. And by the way, like, in addition to cannabis, here's a couple other alternative things that you could try. And people love that. And I think cannabis helps make people more open-minded. Nowadays, it's quite different because most of my new patients are people that have just been through everything that conventional medicine has to offer them. They're like at their wits' end, and like cannabis is their last resort. And it seems like, they're opening the door to the last resort, and there's this whole world out there of things they didn't know about. We're doing so much. And so, it takes a visit or two to kind of get the cannabis dialed in, and then we're continuing to see people and watch them get better and better and better. There's just so many obvious examples, but like a woman in her 30s with severe migraine, almost every day having a migraine, can't even wear a scarf or a necklace. She came in with the desire to see if cannabis could help cure her migraines. And we got her using cannabis, and it certainly helped her sleep, which decreased the frequency of the migraines, and it decreased the intensity of the migraines, but it didn't make them resolve, didn't make them go away. But then we started doing some osteopathic treatments, and I got her on magnesium and a few stretches and exercises that I recommended based on my findings. And 3 visits later, I just saw her this past week, and I said, I don't really need to see you again. Come in every once in a while for a tune-up. Her migraines were completely cured with this multi-pronged approach. And I think that so many of us are used to this conventional medical paradigm of like, where's the magic bullet? There's got to be something that I can do that'll cure me. And a lot of people aren't realizing that it's typically a combination of things that's really going to work the best. And physiology is like that, right? Like with the simple like cause and effect, the idea that you can take a single molecule and expect to have a profound lasting impact on this entire super complex polyrhythmic system, is pretty, that's a pretty reductionistic perspective, and so approaching this in a way that's going to affect multiple parts of the system to kind of nudge it in the right direction just makes so much more sense.
Yeah, actually, I heard you reference, just off the back of that, I've heard you reference this many times where patients feel like they're getting their life back from cannabis. And there was an Israeli study you referenced as well, where they were looking at the same thing. And from the doctors that we've spoken to in Australia here, they would tell us that the results aren't always immediately or even noticeably like quantifiable, like conventional medicine. And I guess that's a a process that you have to undertake as a practitioner to tell the patients it's a shift. It's not just a different type of medicine. It's a whole shift in thinking, right?
Absolutely. And what can do that? How many, I think, answering my question, what kind of treatments or medicines can do that where somebody feels more like themselves and feels like they have their life back, even if their symptoms haven't changed, and they would rate their quality of life as much better, even if nothing concrete has changed. So first of all, most of conventional medical practitioners are going to miss that because the visits are too short to really get the patient to open up and explain this thing that's pretty hard to explain, but they're feeling better. And also, cannabis doesn't fit well into clinical trials for that reason. When you're telling them to rate your pain on a scale from 1 to 10, and they're like, well, the pain's still there, but it just doesn't bother me. And actually, now I relate to it like it's a teacher in my life instead of a tormentor. Like that doesn't fit on that 1 to 10 scale. So, consciousness altering medication and activities, whether it's cannabis, the psychedelic medicines, meditation, mindfulness, there's a lot. Breath work is super powerful. And yeah, I don't even know where we were going, but it is an unusual, like this does kind of shift our paradigm so far from the typical outcomes medicine is wanting to something that's way deeper and more important.
Yeah, it definitely feels like, again, only from listening to you speak about this in more depth, but it's always felt to me like there's something happening below the surface with cannabis medicine. And I don't know if it was you or listening to another case study where somebody's life is changed for the better and they're not exactly sure, because it's not as if the pain is completely depleted. So if somebody has chronic pain, they use cannabis, it doesn't work in the same way that conventional medication or painkillers works, right? But there's something happening below the surface where the person is able to detach somewhat from the pain.
Yeah, to transform it. And this is very well informed by my background in hypnotherapy. Essentially, the goal of using hypnotherapy as a treatment for pain is to take this sensation that arrives at the brain and becomes interpreted as bad, as having, limitations. And there's all this judgment around it, and then all this anxiety about having more pain. And it's just this bundle of misery. And so the hypnotherapy approach is to transform this into a more neutral sensation that the patient has the ability to both intensify. So in a deep hypnotic state, we reach the pain. We're in this kind of control center, and there's a knob on the pain level. The very first thing we do with that knob is crank it up a notch or two, because once somebody has the realization that they can actually make their pain more intense, then they can also crank it down a couple notches, and they're in control. Like some level of empowerment goes such a long way for someone with any chronic condition, but I think especially pain, and especially debilitating pain that's really made their lives a lot smaller and more restricted. And then they realize, wow, I actually do have my hands on the rein of this, at least to some extent, and I can control this. I mean, that's one of these deeper things that's hard to quantify that cannabis can do. And I think for the viewers, cannabis does relieve pain. It does tend to decrease the intensity of it, even on these scales, and it tends to change the quality of it. So it's not that it's ineffective for pain, but the other gifts that it offers, in my opinion, are usually more important.
Man, you need to do like a webinar or more work into hypnotherapy with cannabis medicine. Is that something on the radar for you? Or?
Sure. Yeah. I mean, I've found that my cannabis using patients, whether they're acutely under the influence of cannabis or whether it's just something that they're used to in their life, they tend to enter trance states faster and deeper than before I started working with cannabis patients. But yeah, I mean, hypnotherapy is an incredible modality. I mean, there's rapid trance inductions that can take 5 to 10 seconds and shift someone from their ordinary consciousness into a deep state that they haven't visited anytime recently or ever. It's just, we think we might need cannabis to do this or a psychedelic drug to do this or whatever. I always emphasize our inner pharmacy can do all of these things much faster and more precisely and more powerfully than any external drug. It's just this big mystery of how to unlock it. But yeah, I mean, sometimes setting up a few expectations in a conversation, literally shouting at someone and slapping them in the head, followed by some gentle suggestions that they go deeper. I know that sounds crazy, but that's how some of these rapid inductions work. And they're in a deep, subjective, open state where their conscious and subconscious are more fully or very fully connected and able to work through things that are limiting them. And just since we're talking about this, because I think it's relevant to cannabis as well, in hypnotherapy, the operator, the therapist is not determining where we're going next. It's the subconscious mind. Like as soon as we're there, the subconscious mind of the patient knows what it wants to bring up, what's important to work on, what's the priority, and it shows that. So it's like this incredibly self-directed healing process, which is really the way all healing works. I think so often as doctors or healers or other types of practitioners, we think it's all about what we're doing to the patient or what we're doing for the patient. But really, it's so often about, can we help the patient open the door a little bit or remove the obstacle and then do their thing? And that thing is just mysterious and beautiful.
The inner pharmacy, I really love that. But I guess it's really exciting to see different plant medicines like psilocybin treatment coming to the forefront a little bit more and being a little bit more accepted as well. It's another powerful tool.
Absolutely.
So I wanted to dive in a little bit into the ways in which you introduce small amounts of THC, because I know for a fact, especially here in Australia, people are, scared by the thought of using THC. And I just wanted to have you explain how it doesn't need to be an overly psychoactive experience or even an uncomfortable experience, and how you go about bringing patients who aren't normally used to THC into that realm.
Sure. Yeah. So nowadays we have a lot of patients presenting that they say they're here to just use CBD, or once they get in the room, they say that, they just don't want to get high at all. They don't want to get high. They keep saying that over and over again. And that's actually not something new. We used to get some of that, years ago, even before CBD was known or available. But, what I've been explaining to people, and I'd say this is true about 95% of the time, is that when using THC, there's typically this therapeutic window. And so that means there'll be a certain dose where you're getting a therapeutic effect. And then there'll be a higher dose where you're getting a psychoactive effect. And by psychoactive, I mean perceptual altering. And so for people that are watching this that haven't experienced it with cannabis before, I think it's useful to describe what it's like. It might be enhanced sensation. So all the same sensations you're used to, it doesn't blend them or shift them, but it makes them a little bit more sensitive, a little more enhanced. So someone might feel their body more, they might hear the instruments more individually in music, or they might find themselves seeing new things in a piece of art that they've looked at so many times before. So just a little enhancement. Some people feel a little bit clumsy, and that's typically when they're very new to cannabis. The brain accommodates for that very quickly after they have a little experience. And some people might feel a little heavy in their body, tired, wanting just to relax and lay down. Some people might feel a little forgetful, which is another way of saying really in the present moment. So like not thinking about the past or the future, but just, again, being with their senses. It's part of that enhanced sensory experience. Now, this can be very mild, even to the extent where it wouldn't impair someone's ability to drive or anything like that. That's just a little bit over that threshold, and then as somebody uses more and more cannabis, this can get, the level of THC can literally create a psychedelic-like experience. And so there's a wide range of psychoactive effects. It's not just like, is it psychoactive or not? There's a really broad range. But back to this therapeutic window, someone who's brand new to cannabis, no experience with THC, say they want to use it for pain, for anxiety, for sleep, for muscle spasms, for diarrhea, for nausea, vomiting, they are almost always, like I said, about 95% of the time, able to take a dose that lands them inside there so that they are getting that therapeutic benefit, but they're not going over the line into psychoactivity. And so, and that's beautiful. How do we do that? Start low, go slow, keep going methodically until you get in that window. Here's what to look for in terms of a therapeutic experience. Here's what to look for in terms of a mild psychoactive experience. If you get that, you can reduce your dose slightly, and then you're in the sweet spot. So then we follow up with the patient. 1 or 2 follow-ups go by. Now they've been using cannabis for a few months and haven't ever experienced some of these beautiful, profound healing, effects of the THC. And so very often what I'll tell them, because a lot of my patients come in with disturbed sleep, and so I'm having them use a dose of THC by mouth an hour or so before bed, or right at bedtime. And so what I'll tell them is, let's have an evening. Let's plan an evening where you turn off your phone, the TV is not on, you're either by yourself or with someone that you're very comfortable with, where there's no likelihood of conflict. And that nighttime dose of THC that you usually take before bed, let's take that like 4 hours earlier and just see what happens. And people come back so surprised. They're like, that was it? That felt really nice. That felt like a couple glasses of wine, but better, and they were expecting something really far outside of their ordinary experience, where really it's more of like an augmentation of the ordinary experience with a few different, a few new perspectives, so to speak. So that's one way that I go about it. And then the other way is with people with inhalation. And I think that that's very valuable as well. The difference between achieving psychoactivity with inhalation versus an oral dose is that the inhalation comes on very quickly. And from what I've heard from thousands of patients over the years is that rapid change gives them a level of perspective that they don't get with the slow onset of the oral dosing. So it's like, they might be, just feeling miserable and take one inhalation of a pipe or a vaporizer. I'm not talking about smoking a whole joint. I'm talking about maybe 1 or 2 hits. And then 5 minutes later, maybe even 2 minutes later, they feel so vastly different. That transition becomes educational to them. They learn something from that. Like, then the cannabis wears off. It's the next day, and that lesson remains with them. They've learned something that's permanent about that suffering. Next time they're in that misery and suffering, they know that it's possible for that thing to shift that quickly, that they don't have to stay there. And whether it's cannabis that they need to shift out of it, or maybe over time they realize they can shift out of it just on their own with the lessons they've learned. And that's typically the case. So there's, while I often introduce people with the oral dosing, eventually we'll get to the inhalation, because that's just so rapid and really useful.
That's incredibly interesting. So the inhalation is not just different in terms of like onset or duration. It's the fact that the shift happens so quickly that it becomes experiential.
Exactly. You nailed it.
Amazing. Oh, wow. So I guess I wanted to speak, I guess that segues nicely into that term that I mentioned before that I've heard you speak about, which is anhedonia. I hope I pronounced that
Yeah,
correctly.
you got it. Yeah.
And I just think from most of the people that we've spoken to over the last 2 years, or last 2 or 3 years, it's not just one condition people are suffering with when they're seeking this medicine as a last resort. It's, insomnia and sleep issues, anxiety, depression, chronic pain, all bundled together. And when I heard you mention anhedonia as this condition where people have an inability to experience sensations and enjoy nature and enjoy things that they should be able to enjoy, it just really felt like this must be occurring for so many people as a downward spiral. So can you speak a little bit about that term, what it is, and how cannabis can help potentially treat it?
Absolutely. So the term literally means the inability to experience pleasure, but it's usually applied to the pleasure that people experience from natural things in their life, like seeing a beautiful bush of flowers like we have here in the spring, or looking at the face of your baby, or even making love, or literally just like being alive, like waking up in the morning and being like, wow, I'm alive. This is important to me. There's something that I can do with my day, and getting those pleasure signals. There's a lot of reasons why those neural circuits are underutilized And people kind of lose that capacity, just like anything else in life. If you're not using it frequently, you tend to lose it. And I think now we have such quick fixes that give us little bursts of pleasure every time we check our email or our social media, or just like the technology and other aspects of our environment, including drugs, like stimulant drugs, opioid drugs. Like there's a lot of things that can kind of suppress that function. And so people are left in this situation where they're looking at something that they know should bring them pleasure, and they're feeling nothing. Or they're eating a meal, like eating a meal and just chewing it and swallowing it without experiencing the taste and like feeling the pleasure of that. And how many times during the day is there a missed opportunity to experience something that brings appreciation and pleasure, and is also a signal, a feedback signal from our life to tell us, hey, this is the right thing for you to be doing right now. Like this, you're on your path, you're doing the right thing. And so I really saw this profoundly in patients that were using opioids chronically for treating pain, and recognizing that they're really not and I don't want to generalize to everyone, but a lot of the patients I saw were really not experiencing the pleasure from these natural things in their life, and that this was creating a downward spiral where they would become fixated on the few things that would give them that brief little burst. And those things typically are the drugs, and then other things that have nothing to do with building a sustainable, meaningful life, like the social media or some of these other things in technology. Pornography is a great example. I think this goes back to, if you look at our kind of reward system in the brain and animal behavior, and this is a vast oversimplification, but we have the dopamine signaling, which is like a strong pleasure signal. This might be finding some food that's calorie and nutrient dense, and we want to eat it as much as we can because we might not find it again in the wild. And so animals will do that, and they'll get the dopamine signaling. But then there's other activities in life that don't give that instant pleasure. They give more of a feeling of contentment and satisfaction. And animals usually do that to build up to the pleasure. So a great example would be mating rituals. Build a bird building a really complex nest and then doing this dance. Like they're not getting the pleasure signal of mating, but they're getting this serotonin, more like a serotonin signal, maybe an endocannabinoid signal of satisfaction, contentment. They're doing the right thing. And when we lose both of those, then it tends to be like, well, let's just jump over that contentment thing where we're actually contributing to society, helping our family, helping ourselves. We're just going straight to the quick fix, which unfortunately it has to become a stronger and stronger quick fix. And the returns are just diminished over time. And that's that downward spiral into just not feeling. And so how about, considering the experience of waking up in the morning and every minute or every 5 minutes or so often, like maybe every moment, actually appreciating what's going on in your world right now. Like, we're having this chance to talk. You're in Australia, I'm here in Maine. This is incredible. Like we're speaking the same language. We have similar values around this topic. Like this is beautiful. I can feel the appreciation from this. And I know that there would be other people that could just think like, wow, I should be appreciating this right now, but there's nothing. I'm just not feeling it. So how do we build back those neural pathways for hedonic responses to things in our life that are healthy for us is an important question. And I think cannabis can help with that.
Yeah, it's an incredibly important time to be addressing this as well, I think, whereas people have been forced to be more inside, detached more from, healthy connections and pushed further toward unhealthy connections. Yeah. I wanted to ask just one more question. I guess in Australia, again, specifically, doctors are very, very reluctant and almost discouraging in many cases of people looking to medical cannabis as even a second line treatment. So I just wanted to ask your opinion. What are the benefits for doctors to look at using medical cannabis and more integrative health practices and exploring this plant?
Great question. Before we go there, let's jump back to the
Okay.
anhedonia question, because I want to leave your viewers with something practical. So, two tools that I recommend to patients that are very simple. One is if they're going to get into that psychoactive range of using THC, to plan it out so that so that they're not just like watching something mindless on TV and then lighting up and having a toke and then still sitting there watching something mindless. No, don't do that. Turn off the TV, turn off your phone, generate something in your environment that you want to spend the next 5 minutes appreciating. It could be a song, it could be a bouquet of flowers, like whatever it is, doesn't matter. Different every time is fine. But actually take the time to do this. This is a practice called savoring. It's a mindful practice. Cannabis absolutely enhances it. So it makes it much easier to do this, to sit still with that bouquet of flowers for 5 minutes and just love it. Like look closely at the little structures, back up and look at the colors of the whole thing. Look at how the shadows lie and see if that starts generating this sense of appreciation in you. Anyone can do this anytime. You don't need cannabis to do it, but I think that cannabis greatly accelerates that process, makes it possible. And so what we're doing is rebuilding these neural circuits that make it easier to savor even when we're not trying to savor. So it's kind of like knitting. I don't know if you knit, Brad. I don't, but I know if I picked it up now, I'd be pretty clumsy with it, right? But I've watched my 12-year-old daughter. I mean, she learned to knit, probably 5-6 years ago. But when once she got it, now she's sitting there knitting without like paying attention, right? It's like super highways in her brain along these knitting pathways. Well, let's do the same thing with savoring pathways. Let's turn them into super highways that you don't even have to think twice about it, and you're able to savor and appreciate your environment. The other thing that I think is very useful is this recognition that there's always more in our environment than we can perceive. So we need filters to help us ignore certain things and pay attention to certain things. And just because of how life is and many factors here, a lot of us have developed these filters to ignore the things that bring us appreciation and to focus on the things that are threatening. That's kind of a survival mechanism. But if we don't unlearn those patterns, if we maintain those for our whole lives, we're not going to have anything left to appreciate. It's all going to seem threatening. And so I think a great way for cleaning out and changing those filters is something called the gratitude journal. And this takes 3 to 5 minutes. You can do it, 5 nights a week. It's been studied clinically. And the way I recommend it to people is so simple. Before bed, you just write down 3 things that you're thankful for that happened in that day. Doesn't need to be the details. You just write down the headlines, you put down the pen, you look at each one and spend about 30 seconds literally feeling like I received a gift. Sounds like 30 seconds isn't that long. It'll probably feel like forever for a person who tries this for the first time. But that's it. 3 minutes later, you're done with that practice, close the book and go to bed. The next day, subconsciously, you're going to be looking for things to put in your journal that night. And by subconsciously looking for them, you're shifting the filters towards letting in things that generate a feeling of appreciation or this hedonic response. So I wanted to leave your viewers with that. Let's get back to your question about doctors, right? So
Oh, thank
cannabis.
you. Sorry to
Oh,
interrupt. Thank you so much for going back and adding that in there. So the savoring, filtering, and the gratitude journal to rewire the brain doesn't necessarily need cannabis, but I'm assuming a small amount of THC can help somebody new to this kind of practice, especially with increased sensations, even if it's a very small amount.
yes, getting them back into the present moment, enhancing that sensory experience, a little bit can really go a long ways. And again, this isn't like you have to be stoned out of your mind to achieve these benefits. This can be just a little nudge over that threshold of actually feeling the THC. Just a little bit into that territory is all it really takes. More and more, we're finding that tiny amounts of THC are very powerful. So getting back to the healthcare system, right? What's going on with the healthcare system? Is it working? No. I think the answer is a very obvious no in most ways. Of course, it works to some extent. I don't know how bad Australia is, but in the U.S., we spend more on healthcare than any other nation in the world. And when I say more, I mean per person. So like our per capita healthcare expenditures are way over 10,000 US dollars now. It's about 20% of our gross domestic product goes into the healthcare system. And when they rank us each year compared to other developed nations, we rank last or nearly last on almost everything. So are we succeeding here? No, like there's so much wrong with the system. And I think there's very few doctors that are in the system would tell you, yeah, this is really going well. You know, we're helping people very efficiently here. You're not going to hear that. You're going to hear burned out doctors that like have forgotten why they got into this job, you know, most of the time. And certainly not every time. Thank God there's still some people out there that are doing good work in the conventional system. But yeah, I feel that cannabis is a potent solution for these healthcare providers because for many reasons. One, they can see better results with their patients. The whole reason they got back into, you know, the reason they got into medicine in the first place was to help people. But it's hard when you're using tools that just don't work that well or that have so many side effects, you know. And so I think for someone to start seeing, like, you know, we commented on it yesterday. I had a day of patients where it was like everyone was better. My medical assistant was like, today was one of those days, like everyone was better. You know, most doctors just don't have that experience. Even if half of them are better, I think it's going to make them more enthusiastic about their job, and they're going to start, you know, probably paying more attention, digging in more, and caring more about what they can do. The other thing is, cannabis requires the clinician to open up their paradigm a little bit, because this kind of top-down, like doctor in charge, patient is a passive recipient of this treatment. You know, here's your script, take it to the pharmacist. They're going to give you a little pill with instructions on it. Follow those instructions, you know, accurately, and that's the best I can do for you. Versus the cannabis paradigm is more like, here's a tool. I'm going to introduce you to it. I'm going to give you a method for exploring this tool and for checking in with yourself to understand how you're responding to this tool. And then I'm going to follow up with you to help you fine tune it. That's so vastly different. But again, that really emphasizes patient empowerment and individualized treatment, which I think is where medicine has to go if it wants to succeed. So cannabis is great for conventional clinicians that are not interested yet in integrative medicine. They haven't worked with herbs or homeopathy or body work or anything like that, but they're looking for a new pharmacotherapy that can get better results than their current options. And especially in tough to treat conditions like chronic pain, like PTSD, like severe nausea and vomiting, you know, to find an option that just blows the pharmaceuticals out of the water, literally, like way better efficacy, way lower risk. And then once they see that that option is there, then they're realizing, well, I better learn a little bit more about this. There's something going on here. And, you know, dip your toe into the water and it gets very deep, you know, and I think that's great, because a lot of doctors, I think, would really appreciate an opportunity to bring more satisfaction back into their work.
Amazing. I guess off the back of that, I wanted to take a moment to acknowledge the work that you're doing. And I'd imagine it's probably getting a little bit easier, but challenging a paradigm must be very difficult, but it's where the world needs to go, right? And I never experienced you as being like, I don't know, you know, fuck the system, Western medicine doesn't work. I always experience you as being, here's the literature, here's why science is good, and here's the bridge. And I'm really appreciative of that. And people are listening all around the world, and I really honor the work that you're doing. So thank you.
Thank you, Brad. You know, it's easy for people to get frustrated with their doctors. They don't know what those doctors have been through. Medical training is incredibly traumatic. You know, I've seen so many bright, beautiful medical students that just want to help people and learn turn into these burned out, miserable tools, you know, cogs in the wheel. Like it's really sad to see that happen. I've seen their light go out, you know, and you know, thankfully I had tools. Cannabis was one of them to help me survive my medical training quite intact. And also, I've always been a kind of a proponent of self-directed learning, and I didn't do as much mainstream conventional training as most other doctors. I just did one postgraduate year and went straight into practice. And ever since then, I've been learning what I think is important for me to learn to help patients. So, and then, the bias against cannabis, like, imagine if you had gone through 7 years of conventional training, significant sleep deprivation, which diminishes our capacity to think critically, high stress, seeing people die, seeing people suffer without the ability to help them, even though you have this broad range of tools. That's hard stuff to deal with. And during that whole training, typically the only thing they've ever heard about cannabis is substance abuse disorder, cannabis hurting people, cannabis ruining people's life, repetition over and over again. So don't blame them for taking a little while to like get over that, when they're trying to like think about this in a new way. What cannabis could, be helpful for some people? You mean it could be really helpful for a lot of people? You mean like my toughest cases might very quickly and easily respond to cannabis? It's a big leap. So be patient and gentle with them.
Yeah, well said. Thank you. People can find you through the Healer platform is the best way, your work?
Yes, healer.com is the best way. Back in 2015, we put that website up there because everywhere where I traveled, people, just said, hey, we want the patient education material you're doing with your patients. We need that here. And so we said, this is an offering, and we designed that information to be compatible with anyone, regardless of their jurisdiction, whether they're growing it in the backyard or, buying it illegally, or whether they're in a, jurisdiction where they can go to the store and have all these great products that they can choose from that are accurately labeled. It's an offering to really put the empowerment back in the hands of the patients so that they can take better care of themselves using cannabis. And then, back to the solving the problem with healthcare providers, I do have a book. It's coming out in the US on June 29th. I don't know how and when it'll be available in Australia. It's called Handbook of Cannabis for Clinicians, Principles and Practice. And it is a text, but the chapters are concise and very accessible. And what I'm recommending to people is to buy a copy and give it as a gift to your doctor. And if your doctor has that sitting there, and every once in a while a patient asks them about cannabis and they realize they don't know the answer, they're going to open the book at some point, because doctors hate saying, I don't know. That's another thing from medical training, is that you're not supposed to not know. You're supposed to know everything, and hopefully cannabis can help them get over that problem as well. And again, I'm overgeneralizing here. Like there's a lot of good doctors that are very comfortable saying, I don't know, but it is kind of a part of the culture and a part of the training, at least from my experience. So Handbook of Cannabis for Clinicians, healer.com, all the free content is there. The paid training program is there. If you sign up, you'll get information about the monthly webinars. And I think that's about it.
Amazing. Thank you. Handbook of Cannabis for Clinicians. So we look forward to that coming out, and we'll have links to it as soon as it does.
Thank you.